By December 29th, 2022, Lindsay told her husband, "I ain't tough it out and more. I need to go to McLean." On December 30th, Lindsay went to the MDH emergency room, which suggested admission to McLean Hospital. On December 31st, 2022, Lindsay admitted herself to McLean Hospital, the nation's top-ranked psychiatric hospital, due to her severe depression and suicidal ideation. Lindsay's admitting symptoms included passive suicidal ideation, feeling detached, hopelessness, depression, no appetite or energy to perform activities of daily living, no motivation, anhedonia, racing thoughts, inability to organize her thoughts, memory problems, anxiety, and insomnia. Her insight and judgment were documented as limited. 62. McLean placed Lindsay on a locked unit with 15-minute suicide checks. However, the care she received was grossly inadequate. She was admitted on New Year's Eve, and there was a skeleton crew because off holiday, patients spent their evening doing puzzles and coloring. Nurses stayed behind a desk and glass. Lindsay did not see a doctor until January 3, 2023, 3 days after admission. On January 3, 2023, 3 days after admission, Lindsay did not advise Lindsay to stop Seroquel and benzodiazepines and prescribed since the Seroquel decrease. She VVAs approved for discharge. Lindsay VVAs discharged from McLean Hospital on January 5, 2023, after only a 5-day stay, and was returned to the care of the same outpatient providers who had been providing allegedly substandard care. After discharge, Dr. Goodhart from McTeen called Lindsay and spoke for only 10 minutes, offering names of antidepressants. The staff at McLean suggested amitriptyline, yet another antidepressant, the Ven class of medications that had repeatedly caused Lindsay to have adverse reactions. 66. When Lindsay VVAs discharged from McLean, she thought, "I was just in the best hospital in the country, so there was not much hope." She decided she must appear like she VVAs okay and had to do her best. McLean Hospital's negligent failure to properly evaluate Lindsay, obtain an adequate psychiatric history, provide sufficient inpatient care during her brief admission, and ensure appropriate discharge planning and follow-up care directly contributed to the tragic events that followed. Lindsay returned to treatment with Dr. Tufts on January 6, 2023, the day after her discharge from McLean. Dr. Tufts diagnosed Lindsay with chronic major depressive disorder, single episode, moderate. She recorded that Lindsay's psychiatric condition was deteriorating and that her medication was not effective. Despite her poor condition, Dr. Tufts met with Lindsay for ONLV 17 minutes. 69. At Cora's birthday party on January 7, 2023, Lindsay was not herself. She smiled but could not converse. She avoided talking and could not make sense of what others were saying. Lindsay's hallucinations resumed within 1 week after discharge from McLean. 71. On January 10th to Dr. Tufts and was switched to Valium for a benzodiazepine taper. Dr. Tufts indicated that an antidepressant. On January 16th to VVAs, 1623 Lindsay VVA is still experiencing debilitating. "You should kill yourself. You will never be the same. The only option is to die." She felt like a zombie. Dr. Tufts prescribed amitriptyline, another antidepressant, at mg per day. 73. On January 20, 2023, because Lindsay was having such awful thoughts and was so numb and emotionless, she researched what is a psychopath, to see if she was one, and whether there was a cure. On January 23, 2023, during another 17-minute appointment, Lindsay reported being a little more anxious with heart racing, and more anxiety. Dr. Tufts recorded that Lindsay's mood is the same flat anxious, that she had no motivation, numb, and has to force herself out of house. Her sleep and medication efficacy veer poor, her insight was poor, and her psychiatric condition generally VVAs unchanged. Dr. Tufts increased the amitriptyline to 20 milligrams per day. That night, Lindsay did not sleep. Aged January 23. That night, Lindsay did not sleep with thoughts. She gave the children breakfast. She gave the children Built-A-Snava cake. Later, Built-A-Sidal hallucinations continued all day non-stop. Later in the afternoon, the voice began saying, "You should harm the children." Lindsay thought about dinner and realized she had not prepared anything. She asked Patrick about takeout. She looked at a map to see how long it would take because she did not want to be alone and needed help. 77. As soon as Patrick left to pick up the food, there VV is a loud, demanding, repetitious voice. "This is your last chance. Kill the children so you can kill yourself. This is your last chance. You have to kill the kids so you can kill yourself." Lindsay felt a force come over her. 78. Lindsay experienced command auditory hallucinations. A demanding, powerful male voice explicitly ordered her. She felt an overwhelming, irresistible compulsion to comply, entering a dissociative, dreamlike state where her physical actions felt utterly disconnected from her conscious volition. She perceived her body was just acting, and she was merely watching herself do it. She reported she had no choice but to follow these compelling directives. 79. Lindsay described, "I lost all control. My body started acting without any control on my part. One VVA just following commands, all action." This voice demanded action. 80. Lindsay proceeded to strangle each of her children, uttering, "Go to God, baby." Following these acts, she undertook a severe suicide attempt, ingesting a substantial quantity of various medications, self-inflicting lacerations to her wrists and neck, and jumping from a second-floor window approximately 20 feet to the ground below. 81. Lindsay suffered catastrophic injuries, including a thoracic spinal cord injury resulting in permanent paralysis below the sternum. She also suffered multiple closed fractures of her cervical and thoracic vertebrae, and multiple rib fractures. 82. Cora and Dawson died on January 23. Catlin succumbed to his injuries. Her actions were compelled by a hallucinatory voice, not a conscious decision, and expresses profound, enduring love for her children. First expert psychiatric opinions. 84. Dr. Margaret Spinelli, clinical professor of psychiatry at Columbia University College of Physicians and Surgeons and founder of Women's Program in Psychiatry at Columbia University Medical College, conducted a comprehensive forensic psychiatric evaluation OT Lindsay. Dr. Spinelli met with Lindsay for 5 hours at Tewksbury Psychiatric Hospital on June 11, 2024, and subsequently spoke with her by telephone for 3 hours on September 6. Dr. Spinelli, Lindsay's sister Allison Olga, Lindsay's mother Mrs. Musgrove, and Lindsay's mother-in-law. Severe. Dr. Spinelli diagnosed Lindsay with bipolar disorder 5 severe, with psychosis and anxious distress, with postpartum onset. Dr. Spinelli concluded that Lindsay had a baseline bipolar disorder with minimal symptoms after her second childbirth, and that her symptoms worsened after her third birth when she was prescribed an antidepressant. Dr. Spinelli noted that an antidepressant medication can create manic or hypomanic symptoms and mood instability in one who has a bipolar illness. This is a Vell-Novian response for a person with underlying bipolar disorder. 86. Opined that the providers never seemed to communicate with one another, that no one ever asked her to describe the content of her intrusive thoughts, which were in fact hallucinations, and that Lindsay was repeatedly given antidepressants instead of a mood stabilizer. Dr. Spinelli's failures of multiple providers. Regarding the initial Zoloft reaction, she noted that if practitioners had recognized the hypomanic activation after Zoloft, a second or third antidepressant would not have been tried. Regarding women and infants, she noted that Dr. Diaz did not review mood symptoms of last pregnancy and this postpartum period, and did not review hypomanic episode immediately after delivery, which was the beginning of MR's. Clancy's postpartum psychosis. 88. Dr. Spinelli concluded she did all that she could to obtain the appropriate treatment. 89. Dr. Paul D. Zeisel, Psy.D., a forensic psychologist, also conducted extensive clinical interviews with Lindsay and her parents. Dr. Zeisel was the initial forensic expert to engage Lindsay in the immediate aftermath of the incident. 90%. Dr. Zeisel concurred with the assessments of Dr. Spinelli and Dr. Philip Resnick. Dr. Zeisel opined to a reasonable degree of psychological certainty that Ms. Clancy's clinical course was significantly complicated by polypharmacy.